Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Doni Wilson, speaking on natural ways to improve fertility. Dr. Doni Wilson is a Doctor of Naturopathic Medicine, natural health expert, nutritionist, and midwife. She specializes in gluten sensitivity, intestinal permeability, adrenal distress, insulin resistance, neurotransmitter imbalances, hypothyroidism, women's health issues, autoimmunity, and epigenetics. For nearly 20 years, she has helped women, men, and children overcome their most perplexing health challenges and achieve their wellness goals by crafting individualized strategies that address the whole body and the underlying causes of health issues. She's the creator of the Stress Remedy program and author of the Stress Remedy, Master Your Body Synergy and Optimize Your Health, as well as the best-selling ebook, Stress Remedies, How to Reduce Stress and Boost Your Health in Just 15 Minutes a Day. For more information, visit her website at drdoni.com. Welcome, Dr. Doni Wilson, to the call. So excited to have you on the show today.
Thank you for having me.
So today we're going to be focusing on natural ways to improve fertility, and I'm really excited for our listeners to hear all of your wisdom regarding this, because you have a background as a naturopath and a midwife, which I think is really fascinating. So I'd love for you to start off by just sharing with our listeners a little bit about your own personal story of how you got interested in holistic health and naturopathy as well as midwifery.
Well, I've had a lifelong interest in how food affects our health, starting from childhood. And so then when I went to get my bachelor's degree, it was in nutrition and in science. And I worked with gynecologists at that time. I was deciding whether to become a medical doctor, and ended up meeting midwives in the gynecologist's office and was really inspired by them, and as well as inspired by the idea of how food can be medicine. And so I learned about Bastyr University in Seattle, Washington, and decided to get my naturopathic degree from Bastyr University. And at the same time, they also have a midwifery program, so I did the midwifery training at the same time as the naturopathic training. And
wow, that's
have
a
been
lot.
practicing. Right? It was a lot. It was not much sleep for several years there, but I've been practicing since 2000. So this is my 16th year in practice, and I have focused. I haven't been doing attending births for a number of years, but what I do a lot in practice is helping women to get pregnant and supporting them with naturopathic approaches during and after pregnancy, which I love. I really enjoy that. And it's actually, I would say, the work in women's health I've learned so much that's inspired me to use that information for other than women, for men and for children as well, and women of all ages. In fact, my other interest really is in stress, and that came from looking at how stress affects women when they're in labor. And what I learned from that, I have now applied to all of us when we're under stress, including when trying to get pregnant, because stress affects fertility as well.
Oh, definitely. That's fascinating. And I think a lot of people may not necessarily be familiar with the type of training that goes into the program that you went to become a naturopath, specifically that university. And I didn't even realize they offered a midwifery program. But, can you just share a little bit maybe about that education process and exactly what it entailed?
Sure, yeah, it's, you do a bachelor's degree first, basically pre-med courses before starting a naturopathic degree. And then the program is usually at least 4 years, or 5 years, like in my case with doing the midwifery training as well, it was 5 years. And it includes the courses you would think that anyone would need to take to be a practitioner. So all of the anatomy and physiology and microbiology and pathology, so all of those science courses. And then what we do is in addition to learning about medications, we have to do all pharmacology courses as well. But in addition to that, we learn about food and nutrition and herbs and homeopathy and how to really, our goal is to understand the person as a whole, our health as a whole, how all the different systems in the body work together, and how to get to the root cause of health issues, to really understand the cause. And by understanding the cause and addressing the cause, then we see that the body can heal and improve health. So it's really that philosophy of using as natural approaches as possible, although again, naturopathic doctors are also trained to prescribe, and do in certain circumstances, but it's really a matter of how do we support the body back to health and prevent health issues is the philosophy.
Mm-hmm. Yeah, and I love that. It really resonates with the chiropractic philosophy as well. So, totally makes sense to me. It's perfect. So I know you're really passionate about, women's health and specifically, like you mentioned, fertility and supporting women after birth as well. Let's talk about some of the top ways a woman can actually help prepare herself for a healthy conception.
It's a great question, and yeah, I'm definitely passionate about this. And I think depending on where, you really want to look at where the individual is coming from. I would say if, sort of starting from scratch, I would start by looking at diet. So we'd be, some of the things you'd want to do to improve the, potential of getting pregnant. I would even be thinking of decreasing sugar intake, avoiding alcohol, even eliminating processed foods. And then I am usually recommending that patients also avoid gluten and sometimes other foods if they have food sensitivities. And I mention these things because there actually is research to show that things like sugar and alcohol and gluten and processed foods actually decrease fertility. So again, we're addressing the cause, right? So if something you're eating is decreasing your fertility, then the way to address it is to eliminate those things from what you're taking in. So we can go to
possibly caffeine as well, right?
Caffeine, there's another good one. Yes, especially if you're finding you're having too much, probably, like 1 cup of tea or coffee is not going to have that much impact, but certainly once pregnancy happens, it's something that we usually eliminate, or we definitely eliminate, but just cleaning up your diet, basically, taking out the things that would be just a little too much of this or that. And it's, it's interesting when we look at these a lot of us know these are things that would improve our health in general, right? Avoiding sugar and alcohol. It's just that when we start thinking about a pregnancy and another little being growing inside our body, sometimes we are more motivated to make these changes. And so I think it's a really great opportunity for women to experience how do they feel? How does their health change when they really are motivated to make these differences in their diet? The other thing is that this is also dietary, is to we want to be balancing blood sugar levels, because what we know is when blood sugar levels fluctuate, like say if you have too much sugar or even a high carbohydrate meal, even if it's pasta or vegetables, if it's a high carbohydrate without enough protein, the blood sugar rises and then within an hour or 2 or 3 falls again, and that roller coaster of blood sugar levels high and low, or even going long hours without eating, I just refer to all of that as a blood sugar imbalance. It directly affects the ability of the ovaries to ovulate successfully. So even just helping to make sure you're feeding yourself something with some protein in it and healthy carbs and fats, but consistently through the day is going to make a big difference.
Yeah, that's such a good point. And I was just going to say that's also because we're talking about insulin and glucagon, which are made by the pancreas. That's one of the neuroendocrine glands. So it makes sense, too, that just having your blood sugar be imbalanced, that could impact the hormone levels of the other neuroendocrine organs.
Yes, and one example of that is a condition called PCOS, the polycystic ovarian syndrome. What the research is showing is that it's very much related to insulin and blood sugar balance. But I would take that information and apply it to all women, even if it's not diagnosed as PCOS. Regulating and optimizing blood sugar levels is only going to help. Think of it as you want your ovaries to get the clearest signal, and anything that scrambles that signal is going to, you may still ovulate, but the ovulation may not be as successful, the egg quality might not be as good, and the progesterone level might not be as optimal. So if we can sort of remove anything that might affect that signal to the ovaries, then we're going to improve fertility. And so that's where blood sugar and insulin optimization comes in. Same thing even with when it comes to stress and cortisol. Another hormone is our stress hormone, cortisol. And when we're under, high levels of stress. Now, a lot of times when people think of stress, they think of, say, something traumatic. And it doesn't that definitely will affect fertility. Sometimes women will share, when I was going through this really stressful time, sometimes even the menstrual cycle stops. And that just shows you when we're stressed, that's not the time our bodies will be most fertile. It's not what, needs the most attention at that moment. And so, but even again, on a low grade level, even if it's daily stresses from deadlines at work or, stresses at home, or, just, not getting enough sleep, then that stress can affect the cortisol levels, and if cortisol levels are either too high or too low, it will change the ability of the ovaries to ovulate successfully.
Mm-hmm. Yeah, that makes so much sense.
Yeah, so even just starting with, even if you don't know yet for yourself, you could just start with, say, going, hey, maybe I need to just make sure I'm getting at least 7.5 hours of sleep every night, getting yourself to go to bed earlier so that you have enough of a chance to get 7.5 hours of sleep. Or if you're noticing during the day that you're feeling stressed, then build in some breaks so you can take a walk or breathe or just enjoy nature or music. That helps the body to re-optimize the cortisol levels. And if you find that that's not doing enough, where you're still feeling overstressed or not sleeping well or too tired, feeling very fatigued, that's when we're going to want to look into lab tests to get a little more detail on what's going on and how to help.
Mm-hmm. Yeah, so let's talk a little bit about if a woman is actually having some fertility challenges, maybe she's been trying for a while, prior to going to, going through a fertility route of using synthetic hormones and IUI, IVF, is there something that a woman could do before getting to that step? So I think that's what I find is a lot of women, especially in the New York area and your practices in Manhattan, let's say they've been trying for a few months with their partner and they're not getting pregnant on their own, so they just jump right into fertility a program that is using synthetic drugs and other hormones and things like that. So, but what can a woman do possibly prior to that she may not even need to go on synthetic hormones to help improve her fertility?
Mm-hmm. And I love that. I definitely, because there's a lot we can, choose and do before, deciding that more help is needed. And in terms of lab work, even just, getting some regular blood work done. And sometimes practitioners don't do certain tests. So I would want to, make sure, because they'll usually check for anemia, which is a good thing to check for. And they will check for liver and kidney function, which is definitely good, but a lot of times those come back normal. So then I would also suggest to check on thyroid function, which would be at least a TSH, but preferably also a free T4 and free T3. And, cause those are the thyroid hormones. And this tells us how well the thyroid gland is functioning. Again, another hormone that can affect, ovarian function and fertility. So we want to, sometimes even if the thyroid function is just borderline low, can be influencing fertility. So, working with a practitioner who can help you really determine, hey, is my thyroid working as well as possible? And if not, what can I do? Is there, there's dietary changes, there's nutrients, there's herbs we can use, or hormone treatment if necessary to help the thyroid be optimized. And then I would also look at, there's some other nutrient levels in the blood that are important. Even if there's not anemia, I would look at iron levels, which is best tested as a ferritin, F-E-R-R-I-T-I-N, ferritin. And then I also like to look at magnesium levels, which would be not just tested as magnesium, but what's called an RBC magnesium, so we can actually see the magnesium level in the cells. And then something called homocysteine, which we can talk more about folate, but homocysteine, 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 helps us understand how well the body is metabolizing folate, B12, and B6, which are really important nutrients, those B vitamins for fertility.
Right.
So that was the blood work.
Okay, so that's some blood. What about is there other functional tests that a woman could do? And maybe perhaps, like I said, you were mentioning maybe her primary care or her OBGYN may not be ordering these tests, but going to more of a functional medicine practitioners like yourself, you would be ordering additional testing. What other tests are out there?
Yeah. So there's also, and yes, I would definitely so if this hasn't been done yet, I would say look at what tests have been done. It surprises me sometimes that, women will be trying to get pregnant and tests haven't been run yet, so definitely, you may even have to kind of jump in and figure it out for yourself and make a list and either see a practitioner who will order them or ask your doctor if they will order them. But the other types of tests, we were talking about cortisol in terms of stress. And the best way to test for cortisol, because they can test it in blood, by the way, but then we just find out the cortisol at the time the blood was drawn. And cortisol changes throughout the day. It should be higher in the evening and decreasing gradually through the day. So what we want to do is actually measure the cortisol at least 4 times through the day, from morning, midday, evening, and bedtime. And we can do that, we usually do that either with a saliva test, where you're spitting in a tube at those 4 different times a day, or with you can also do it with a urine panel, where in the urine they can measure the cortisol that way. So we can really see, is the cortisol high enough in the morning? Is it low enough at night? And if not, again, we can address it using nutrients and herbs. So it's something that we can help the body to readjust. Because what happens is when we're constantly exposed to stresses, our body is always trying to adapt and help us respond to stress. But if the body never has a chance to recover, then the cortisol levels can be thrown off track, either too high or too low. So we want to identify that, the ultimate in terms of a stress test, right? And then we can actually address it and help the body get back on track. So that type of cortisol test. But what I find is that along with the cortisol, because cortisol is made by the adrenal glands, which are down by the kidneys, I also find that it's helpful to measure adrenaline, which is also made by the adrenal glands, and the neurotransmitter levels, things like serotonin and GABA and glutamate. So this way we're getting to really get a full picture of how stress has affected the body. We can see not only how the adrenal glands are managing under stress, but how the neurotransmitters are managing under stress. And again, these things can all influence fertility, and they can all be addressed with nutrients and herbs. So it's like a test that we can actually do something about if there's a result that needs to be addressed.
Yeah, and I feel like that's really can be empowering for women to have some information, first of all, where there may be an imbalance as opposed to just having unknown causes, right, for fertility challenges. And then to your point, there's a lot that can be done from the type of food you're eating to adding in possibly some supplements. And then also, let's say someone is having some adrenal fatigue or some adrenal imbalances, like with their cortisol and such, then also probably some stress management techniques could be employ to actually help their adrenals heal, which will therefore impact their those hormone levels.
Exactly. I mean, a lot of times it's without these test results, things can be in this abstract sense. We all kind of go, oh yeah, of course we all have stress and we're all affected by stress, and it's just like, what am I going to do? But when you actually have these test results, then it's like it becomes so real and it's right in front of you on paper. And so then you can, really work with it in a strategic way. And that's, I think, where we see the real difference with that. Because sometimes it's like, oh gosh, is it worth spending the money? Because a lot of these tests are going to be out of pocket, not covered by insurance. But I can tell you, with 16 years of helping women, that it definitely can, make a difference. But, again, you're going to want to work with someone who has experience with these types of tests, who can help you. The other area, by the way, we mentioned gluten before, and food sensitivities, but this is an area that I really find also makes a difference for women, is to identify whether they actually have certain food sensitivities and if they have leaky gut. Because if we can see that in a test result and start addressing the leaky gut and food sensitivities, that also improves fertility. You wouldn't think so. You kind of think, hey, what does a food or leaky gut have to do with fertility? But it's like our whole bodies are interconnected, and what's going on in the digestive tract is, especially in terms of the immune system and the inflammatory response to foods, also can affect fertility. So that's I think another important one to note. And there are ways to get that done. I mean, when I say food sensitivities, I'm talking about not like an allergy, right? Not like when someone has an IgE response to peanuts and ends up in the emergency room. Because an allergist would test you for that, and you would usually know it because you would have, you know that you have to avoid those foods because of an immediate, severe symptoms. But with the food sensitivities, it's a different antibody. It's usually either an IgG or an IgA antibody, and these respond over days to weeks after you eat the food. So you may not realize right away that you're reacting. It's over even sometimes weeks later that it's what's happening is the immune system is trying to protect you from the food, and it triggers this low-level inflammation that can travel anywhere in the body. And it can cause things like headaches or fatigue or joint pain or rashes on the skin, but it can also affect fertility. And so, but these antibodies to foods can be tested in the blood. It can be done with a blood test, and that way you can, find out which foods. And I think it can be really clarifying, especially for gluten, because gluten sensitivity is 1 in 4 people. Different than celiac disease, by the way, which is 1 in 111, but gluten sensitivity is 1 in 4, and it can really influence fertility. That's something you're going to want to know about.
Yeah, and in general, I'm so glad you're talking about that, because this is beyond an allergy issue. We're not talking about, like you mentioned, celiac, where it's a severe gluten allergy. I would even say higher than 25% of the population has some sort of sensitivity to gluten, because of the way the wheat is processed and the way it's, been altered with, the way it's grown in the past, couple decades. And it really is very inflammatory for our digestive tract. And I'm so glad you're talking about the connection with the gut and the hormones and how that can impact fertility. So in general, definitely being on a gluten-free diet is going to be helpful for anyone trying to get pregnant. And I even have a friend of mine, a nutritionist, who shared with me research where women were having miscarriages from gluten. So even if you are able to get pregnant by being exposed to gluten on a regular basis, when you have a sensitivity, a strong sensitivity can actually even create miscarriage. So I think it is smart in general to just take it out of your diet.
Yeah, I've seen it. I mean, I've seen working with patients where they're trying to get pregnant and either had a history of miscarriage or just haven't been successful of getting pregnant. And when they avoided gluten, usually, sometimes it was in 1 month, but often within 3 months, then they have a successful pregnancy. And it's and that, say, was the only major change, so we definitely see that it can make a difference and definitely worth definitely worth considering. The other thing, like you were saying, is how gluten is processed, because it's, what we see is it's the pesticides that are used with the gluten that also, leads it to be, so much to cause leaky gut. And pesticides in general, can be, something to consider in terms of fertility. I would say even, if you can lean toward as organic of a diet as possible, it's going to be a good thing. But in terms of leaky gut, have you talked about leaky gut? Is that something that your listeners are familiar with?
We've talked about it, how it does impact hormones or how it impacts immune system, microbiome. But, it's a topic that I think I could cover every single episode because it's so important. So I would love for you to spend a few minutes talking more about leaky gut and how that impacts health and fertility.
Well, when sometimes when people hear leaky gut, they're like, what is that? It sounds like it would be diarrhea or something, but it doesn't even necessarily cause digestive symptoms. So many patients would say, hey, my digestion's fine. And it's when we start looking at potential food sensitivities that we identify that the leaky gut is actually present, because what's happening is it's the intestinal wall. It's the lining of the intestine, and what should happen is our food should get digested, and then the nutrients should be the only thing that can get through the intestinal wall to get into our blood. That's how we get our nutrients from our food. But when things like stress and gluten and pesticides and medications like antibiotics and proton pump inhibitors and other things, they end up damaging this intestinal wall. And when that happens, it means that there's little spaces between the cells that line the intestines, and these spaces are so tiny they can't even see it on an endoscopy. So it's microscopic, but it's big enough that a little piece of undigested food could get through there. And when that little piece of undigested food can get through the intestinal lining, that's when the immune system thinks it needs to protect you from the food. So it creates a full immune response to a food. And we usually shouldn't have our immune system protecting us from food because the food should get digested. So that's what leaky gut to me is, that the intestinal lining has been damaged. Now, leaky gut is not a black and white thing. The way I look at it is it's a spectrum. We're all going to have some degree of leaky gut. In cases it gets more moderate or even to a severe form of leaky gut, in which case a person's reacting to more and more foods and having more and more inflammation and more symptoms. And, that's when we really want to help heal that intestinal lining by making diet changes, and we can use nutrients and herbs to help heal the intestinal lining. And when we do that, then over time, and it takes time to heal leaky gut, months to years sometimes, depending on how severe it was, then we see that they are no longer having such inflammatory responses to foods, and the inflammation level starts dropping in their body. So now the body, everything else starts working better. The hormones start working better. The nervous system works better. And so, that's where it plays into fertility.
Yeah, it's so important. And, I do a lot of allergy work here in my office with different, food sensitivities. With NAET, and a lot of people that, let's say you find yourself becoming more and more reactive to different foods you're eating, or you're noticing like, oh, I have, I'm sensitive to these foods that I didn't used to be sensitive to. These are, clear indications that there's a leaky gut issue going on, because as you're eating foods, your body is actually developing these new sensitivities because of like you were mentioning, the permeability of the intestinal wall is too open, and it's actually creating that abnormal immune response of attacking the food because it thinks it's like a virus or bacteria or something like that. So, if you're finding that you're becoming more and more reactive to different foods that you didn't used to have, it could be beyond like, oh, I just have to take these foods out of my diet. It also might be like, I also have to heal the lining of my gut. And that's usually beyond just taking a probiotic. So working with a doctor who can actually help you repair the lining of your gut wall is so important.
I totally agree. And I think it's really good to clarify that and address it. It really can make a difference with fertility as well. And it might mean that you need to take a couple months to really help get your adrenals back on balance and heal leaky gut, and then come back to the idea of fertility. It's worth it, because what the research actually shows is that when moms are in better health, so when moms have healthier cortisol levels and a healed gut lining, that it actually affects and improves the health of their baby. That
yes.
You're actually helping for generations to come, because once your gut is healed and your adrenals are healthier, your methylation works better, which we can talk a little more about methylation and folate. But what happens is folate, right? Usually people hear about folic acid, but folate is what folic acid turns into folate, and folate is what the body uses to make healthy cells and to make healthy DNA. And of course, with a baby, it's all about new cells and healthy DNA, right? So, and we used to think that our genetics were set in stone, that it was just like, my genes are my genes, can't do anything about it. But actually the research shows that we can do something about it. So when you have a healthier diet and you're avoiding pesticides and you're avoiding gluten and you're healing your gut and having optimal cortisol, you actually have a healthy set of genes that you're going to pass on to your baby. And it means that it can actually influence your baby's health and their children's health and their children's health down the line. So it's worth it to take a few months to address these things.
Mm-hmm. I really agree. And I'm so glad you mentioned that too, because a lot of women, at least in this area, in the New York area, are already, let's say over 35. They're considered, advanced maternal age, which I hate that term, but, there's this perception that, oh my gosh, I'm old and I really want to have a baby. And so there's this like rush to get pregnant. And, at the end of the day, it is of course important to be mindful of your age. However, I think the biggest thing is really what is the current status of your overall health, and that's the entire person, physically, mentally, emotionally, spiritually. And if you're really wanting to get pregnant and have a healthy pregnancy, and to create a healthy baby, taking some time, which could be, like you said, up to a few months, to work on your own health, I think is so important. And that would include detox. I mean, I've had other podcast episodes where we just even talked about how important it is to detox and a whole thing. But I mean, if you want to even speak a little bit to that, because you mentioned the epigenetic component where we can actually control our genetics through the lifestyle modifications you mentioned, but also detox would be a part of that. And I think that's so important prior to getting pregnant.
Yeah, definitely. And that's the time to do it, because once you're pregnant, you don't want to be detoxifying then, because then you're exposing the baby to the toxin. So, if you have a sense that, and even if it's a low level, just living in this world, right? And say if you've been in traffic and you've been exposed to exhaust, or say you've had, if you've had, amalgam fillings in your teeth, or if you've had, other exposures to toxins, just even living in this world, breathing this air, it can be a, really good opportunity. And it doesn't have to, it could be something, more of an intense detoxification, but it could be as simple as just saying, hey, I'm going to drink more water, drink less alcohol, have more actual fruits and vegetables and less processed food. Already that's helping your body detoxify, because our bodies actually detoxify every day, all the time. That's what our liver does. So it's more a matter of how do we remove the things that are just adding to the work of the liver. And if you remove those things from your diet and your environment, say get an air filter and you can add in some herbs and nutrients that support the liver to process these toxins out of the body, and make sure your bowels are moving regularly, because most toxins will be eliminated through the bowels, and then drinking water so it can go out through the urine, and maybe do saunas or skin brushing to help it go out through the skin. If you do that, then you're going to be making it less work for your liver, because already once pregnancy happens, the liver is going to have more work just processing hormones. So it's the idea of how can I take away the workload? How can I decrease the pressure on the liver so that it has, more optimal ability to manage pregnancy alone.
Mhm. Yeah. And to also not, pass along those toxins to the baby, during its development in utero. So, yeah, you want to have a clean, healthy vessel, ideally prior to conception. And, this is a hot topic, and this is something that I haven't covered on a podcast episode yet. And I think it's so important for women to be aware of this when they're trying to get pregnant, is about MTHFR. And it's something that I'm finding like it's still not really mainstream and really well known. So I'd love if you could just kind of talk a little bit about what is it, and how does it impact fertility, but how does it just impact our overall health in general?
Mm-hmm. Yeah, MTHFR is a gene, and it's really a family of genes. There's several of them with that name, and their job is to turn folic acid into folate. And we're really used to hearing about folic acid as being important for pregnancy, and that's because some research has shown that folic acid and folate are really important for preventing neural tube defects, which is the nervous system in the baby is developed within the first 5 to 6 weeks of pregnancy, even before you might even realize you're pregnant. So that's why it's really been raised in awareness, is because you want to be having that folate around even before you realize you're pregnant. But the MTHFR gene, it turns out that between 40 and 60% of us have a mutation, at least one mutation on that gene. I say us because I know that I have a mutation on the MTHFR gene, or I have two actually. And what happens when you have that mutation, see, when we speak about genetic mutations, usually people think about major genetic mutations that, say that affect, in a major way on a person's health. But there's also these little, what we call SNPs, which are basically little mutations that affect metabolism. And so you could be, generally a healthy person and end up realizing that you have this MTHFR mutation. And what it means is that any folic acid that you get in your diet or in your supplements might not actually be used by your body. So this folic acid you might be taking in is actually just sitting there and not actually helping your body. And
it's getting peed right out without being converted.
It's not getting converted to folate. So folic acid is actually synthetic. It's a man-made nutrient, and so it's usually in like processed foods. Whereas like spinach, which is a plant, has the right kind of folate in it. So if you already kind of shift away from processed foods and towards, actual, fruits and vegetables, you're going to be already increasing your actual active folate levels. And what you'll find in a lot of supplements, even prenatal vitamins, I would say to take out your multi or take out your prenatal and look. And if it says folic acid on there, that means it has this synthetic form, which means if you're one of the 40 to 60% that has a mutation, you're really not going to be able to use that folic acid. Your body's not going to benefit from it. And so you want to switch to a multi or a prenatal that has, where it should say on the label, actually folate. It should not mention folic acid at all. It might say methylfolate, or it might say 5-MTHF, but it should definitely say folate instead of folic acid. And the reason, again, that we want that folate is because it's used in a lot of ways, actually. Folate is used for healthy cells, healthy DNA. It's used for the development of the nervous system in the baby. It's also used in our nervous system for neurotransmitters, and much more. Energy levels, sleep levels, it affects so many things. Because if you think about it, folate is used in every cell in our body. It actually also affects detoxification because it's a major part of our detoxification pathway. So it's just a B vitamin, but it's a very important B vitamin. And if a person has that MTHFR genetic mutation, especially they should pay attention to it. But I would say, even if you don't know whether you have that mutation, you might as well go with folate because it's a more active form of the nutrient. You might as well. It's not going to be harmful to take folate. Mm-hmm.
Right. So glad you've, talked about that. And, it is a pretty simple test to have done if you wanted to get checked to see if you have the mutation. It's you can do a blood test, but you can also do a buccal swab too, right?
Yeah, you can. I mean,
buccal swab.
It can be done even just in a regular blood test, although you want to check first because sometimes insurance isn't going to cover it, and it could be, a couple $100, so you want to just be aware of that. But yeah, you can do it as as either a swab genetic test or even the saliva genetic test, which will give you the MTHFR information and more. So I'm a lot of times talking to patients about, hey, if we're going to be looking at MTHFR, we really want to be looking at the other genes that also are, working with MTHFR so that we see the whole picture. And so, you can just order, for example, the 23andMe type panel, which is 23andMe is like an ancestry program, right? It tells you, based on your genes, which they can see from your saliva, they can tell you where your family background is from. But we can also take the data from 23andMe and process it through software that will tell us MTHFR and more.
It's so fascinating. So I think it is good information to know, and certainly, and I didn't realize it was as high as 40 to 60%. I mean, that's half the population that have that. But I got my levels. I got myself checked a couple of years ago, and I was happy I didn't have any issues with that. But regardless, to your point, everyone can benefit from being on a methylated folate, and certainly getting that from their diet, their food, like you mentioned, spinach and other good sources of B vitamins, as opposed to fortified foods, which are the processed, like the white rice where they add in folic acid, which is just like silly because brown rice has it naturally and then they bleach it out. But, so like let's say, if somebody does have the gene and they start to take a methylated folate, that's going to not only help prevent like a birth defect, because you were mentioning how this is important for the fetus's development with the nervous system, but also what other things could happen to somebody that has that defect, like heart disease and other things that might be associated?
It's I see patients now with, whether working with fertility, but all different health concerns, whether it's even like anxiety and depression. We help with the MTHFR, and methylation really. MTHFR and folate lead into what is called the methylation cycle, which involves B12 and B6 and B2, and leading toward methionine and homocysteine. And so we're looking at this whole methylation cycle, and that can definitely influence mood. It can influence, say, with PMS, someone who may have a history of PMS. It can also influence with cervical dysplasia is another thing I work with a lot with women in my practice. And, like an abnormal pap smear and HPV virus. And that's an area where a lot of women are left with thinking their only treatment option is a LEEP procedure or a cone biopsy, which can lead to damage on the cervix. And actually what we find is that, and the research shows that a lot of those women have an MTHFR mutation. And when we bring in folate, and we also address some of these other things we talked about today, the cervix can actually heal, and they can avoid a lot of those procedures. So, and I think folate and MTHFR come in there. I also address it with many, like you mentioned, heart disease risk, diabetes risk, and many other scenarios, neurological, say, neurodegenerative conditions, memory loss, and so on. So it really has a big impact on our health. And I guess that's why, we always kind of we're thinking, hey, B vitamins are a good thing. B vitamins are good when you're under stress. And now, based on the research and the Human Genome Project, we're really starting to understand why these B vitamins are such an important thing for keeping us healthy.
Yeah, it's so important. And, if you could just talk a little bit, because you briefly mentioned, folic acid is synthetic. Let's talk about the value of a woman who's wanting to get pregnant being on a high quality prenatal vitamin. And what does that mean? In addition to eating a healthy diet full of real food and avoiding that processed packaged foods, it is nice to supplement with a quality prenatal. And this is going to be very different than a prescription prenatal vitamin, which is made with synthetic vitamins. Can you talk a little bit about that?
Oh, true. I mean, what I always like to explain is that a prenatal vitamin, one of the only differences between a prenatal vitamin and a multivitamin is that they're putting iron in. And so, iron is important during pregnancy, but is it really good to have iron right in with a multi, because iron will reduce the absorption of other nutrients. So a lot of times I'll even have patients use a really high quality multivitamin, and then we'll take iron at a separate time of day in a separate pill. But if you pull out the vitamin you're taking and look at the ingredients and compare, that's what you want to be looking for, and you'll notice that certainly the prescription prenatals and even the prenatal vitamins you get at the health food store or the pharmacy, what you'll see is that one of the main ingredients is the iron. And if you take out the iron and take it separately, then what you can be looking at is, hey, am I really getting a good amount of these other nutrients? And the next thing you'll notice is most of them have folic acid instead of folate. And so, especially if you don't know whether you have that MTHFR mutation, and really, again, I would say for everyone, it's better to choose a product that has folate in it. And they're sometimes not easy to find. I mean, you might not find it probably not at the pharmacy, probably not at even a health food store. You may need to actually work with a practitioner, because some of the highest quality supplements are only available when you're working with a holistic or a functional medicine practitioner, and then you can actually get access to the quality of supplements that are going to be paying attention to these things and making sure that they're putting folate in the product.
Yes, I agree with that. I carry a line here that's, only sold through healthcare professionals, and they have an excellent prenatal, and that's what I recommend. And, the other difference is something like that is not going to be covered by insurance, where a lot of times prescription prenatals are. So there's going to be a cost difference there. But to me, it's well worth the investment in the health of you and your baby to take a much higher quality vitamin that you're going to absorb and utilize those nutrients at a much higher level. And that's so important for keeping your nutrient levels, maintained, as well as helping to build your baby. And that's the other thing I think I want to point out is, like, if you are, pregnant, and the baby will actually leach vitamins and minerals from your body in order to form itself, and that can really deplete a woman that, when she's giving birth, she's just like all her stores are gone, and then if she's pregnant soon after, there's nothing left to give to the new baby. So, it's great to, be maintaining that through the diet and high quality supplementation.
Absolutely, absolutely. And it's so worth it. I mean, even if the prenatal you're getting now is basically free or close to nothing from insurance, but it doesn't have any usable nutrients in it, then it's pretty much not worth taking it, better to...
Yeah, it's a waste of time.
It's like, what's the point? And a lot of the other nutrients in standard prenatals are not in the most active form either. For example, B12, if it says cyano B12, that's an inactive, unused form of B12 in the body. So you really want to get a vitamin that has a methyl B12, for example. So you can, we could go down the whole list of nutrients. A lot of times too, the quantity in the product is too low. If you look at the percentages, it ends up looking high, because the percentage, remember, is based on an RDA, which is basically starting from a total deficiency. So you don't really want to look at the percentages. You want to look at the milligrams, and here it can help to have someone who's at least a nutritionist or say like a holistic chiropractor or a naturopathic doctor, someone who can really help you evaluate the milligrams and show you, hey, here's a product that has the right amount that's actually going to be beneficial.
Yeah, it's so important, so worth it. And this is something that if you're actively, wanting to get pregnant, you certainly don't have to wait until you're already pregnant to start taking it. It's ideal to start, I would think probably at least 6 months in advance, if possible.
Sure. And it's, in addition to, a really good multi with the folate, and actually usually you would probably have to take an additional folate separately from the vitamin or the prenatal. Often a vitamin or prenatal will have about 800 micrograms, and the research indicates that with pregnancy, the more the better when it comes to folate. So sometimes we're adding at least another 1 milligram or even up to 5 milligrams of methylfolate in a separate pill. And then we talked about the iron, but you're also going to want to add, you're going to want to have probiotics, because the good bacteria and probiotics are really important. They have been shown to help prevent miscarriage, to have healthy bacteria around. And then you're also going to want to have the, I would say omega-3s of some form, whether that's, an EPA, DHA from fish oil, or you could do a vegan source of omega-3, but you want to have, omega-3s as well. And so it ends up to be, a protocol of probably 4 or 5 different supplements that you would start prior to pregnancy, like you're mentioning, and then continue through. And then we also want to be thinking about calcium, magnesium, which usually once you're pregnant and you're getting at least halfway into the pregnancy is where the needs for calcium and magnesium increase in terms of the bone development of the baby. And that's especially a nutrient, as you're mentioning, that as the baby's bones are developing, the body will take from the mom's bone stores if there's not enough calcium, magnesium available, as well as vitamin D, by the way. And vitamin D is another one that I usually like to include from before pregnancy, because vitamin D has also been shown to help with conceiving and preventing miscarriages. And so we want to think about that, but we also want to think about making sure to support mom's bone health during pregnancy and postpartum. Actually, with breastfeeding, the calcium needs increase even more. So we could talk about that more another day, but those are some of the other nutrients I think about.
Yeah, and I'm glad you mentioned that. I think the other reason why, supplementing preconception for ideally a few months prior, and even maybe higher levels with like the folate you mentioned. And that could be because if you do have the MTHFR defect, then your folate levels might already be very low. And that's even prior to then making the baby. So we want to build those stores up. And the same thing with vitamin D. A lot of people, when they get their blood work done, which I think that would be another good thing to have in your lab work, make sure your vitamin D's levels are checked. And you want to be over 50. And I think a lot of people walking around, they might even be in the normal range, but they're not that ideal 50 to 80. And that's something that can be improved on with increased supplementation.
Definitely. Definitely, yes. I, by the way, love to write about all of these things in my blog. So if anyone wants to learn a little more too, welcome them to either at, drdoni.com, which is, just drdoni.com. On the blog, there's some posts about MTHFR and miscarriage and so on. And then in the Dr. Doni store, drdonistore.com, I have a pregnancy protocol that shows the supplements and nutrients that I recommend. So then you can go and really see and look through and analyze and compare to what you have, what you're already taking. And this way you have a good sense of, what would be, not only safe, but also effective at accomplishing a healthy pregnancy.
Yeah, I think that's so awesome. So, your website, drdoni.com, is a really great resource. And if a woman is wanting to work with you, I know you do Skype sessions as well. So if they don't live in the New York area, could they still make an appointment? Yeah. Absolutely.
And if you're thinking that you maybe want to just start to get some help in what we talked about today, I recently re-updated my program I call the Stress Remedy program, which includes dietary change and help to implement stress reduction and exercise and supplements and a lot of the things we spoke about today. So even if you're not sure if you want to do a whole consultation, you might want to just start to implement these things on your own. The Stress Remedy program would help you do that.
That's great, and that's on your website as well, so they can just go there, check it out, and that, like you said, could be a great first step for women in just making some basic lifestyle, improvements that will impact their overall health and certainly also help impact fertility. So, Dr. Doni, thank you so much for coming on the show today and sharing your passion for women's health and all things natural. Do you have any last thoughts you want to share?
Yeah. Oh, I just, and I think, you guys get this already. It's just so rewarding to have a call or text me and tell me that they got a positive pregnancy test. And then we're all excited when we get to 12 weeks of pregnancy because we want to, and we know likelihood of miscarriage. And it's just so exciting to see that. Sometimes that, I get those messages coming in, weekly or a couple in a week, and it's just really exciting. I'm so happy for those women, and I know that so many other women could benefit from that information as well. And not only knowing that they achieved this healthy pregnancy, but that it's gonna be beneficial for their families ongoing. So it's just, my pleasure to get to share the information.
Awesome. I love that. I love hearing those little miracle stories in my practice as well. So thank you for sharing. And once again, I appreciate your time.
You're welcome. Okay, thank you. Talk to you soon.